Very good morning to one and all. Myself, Mr. Vinod Mode, welcomes you all for this today's webinar organized by Yeshwantrao Bhosle College of Pharmacy, Sawantwadi, in association with Government College of Pharmacy, Ratnagiri, on the topic 100 Days Strategies for the GPAT 2021 preparations. First of all, I would like to welcome the invited speakers for this today's webinar, Mr. Sachin Jadhav sir. Good morning, sir, and welcome.
Good morning, sir. Thank you very much.
I would like to also welcome the principal of Government College of Pharmacy, Ratnagiri, Dr. Rajendra Marathe sir. I would like to also welcome our principal, Yeshwantrao Bhosle College of Pharmacy, Dr. Vijay Jagtap sir. Good morning and welcome, sir.
Thanks.
I would like to also welcome all the participants, the students of third year and final year B Pharmacy, and all GPAT aspirant students of Yeshwantrao Bhosle College of Pharmacy, Sawantwadi, as well as the students of third year and final year from Government College of Pharmacy, Ratnagiri. Dear students and all participants, as you all know that we all as a students, we are preparing for this GPAT examination since beginning, or we can say since first year also some students are preparing. And this GPAT examination is scheduled in next, we can say, year in January 2021. And along with this regular studies, regular preparations for the GPAT examination, I think it is very much important to have the proper guidance regarding how to prepare for whatever the remaining 3 months are there for this GPAT examination. So I would say that whatever these 3 months are remaining, whatever the 100 days are remaining, these are very much crucial, or we can say these are the game changing period for any students who are preparing for this GPAT examination. So obviously, to get the proper guidance regarding how to plan this remaining 100 days, remaining 3 months, it is very important how to prepare, which topic to focus, how to plan, how to have a time management. So to get answer to all these, we can say points, all these questions which might be there in some students' mind. For that, we had organized this today's webinar on the topic 100 Day Strategies for GPAT Examination 2021. So before starting with this actual session, I would like to give a short introduction about today's resource person, Mr. Sachin Jadhav sir. Sachin Jadhav sir, he is the founder and managing director for Fundamental Pharmacy, an institute which guides the student for preparing the GPAT examination, NIPER examination, drug inspector examination, or some pharmacist examinations also. Sir had completed his D Pharmacy in 2008. Sir had completed his B Pharmacy with first class distinction from JSPM Wagoli in 2011. Sir had completed his M.Pharm in Pharmacognosy and Phytochemistry from Government College of Pharmacy, Amravati in 2013 and stood first class with distinction. Sir had qualified the GPAT examination in 2011, 2018, 2019, 2020, also qualified the NIPER examinations also. And on his credit, he had published total 4 books. Some are related to GPAT and some may be related to some academics also. Okay. So the first is Fundamentals of GPAT. Second book is GPAT Cracker Achiever. Next is Pharmaceutical Organic Chemistry, and fourth book is there, that is Essentials of Drug Development and Clinical Trials. Sir had published more than 5 research articles in reputed journals with the good impact factor. And presently he is working as an assistant professor at Yash Institute of Pharmacy, Aurangabad. So once again, with this brief introduction, I would like to welcome once again our resource person, Mr. Sachin Jadhav sir. And next, I would like to hand over the session to Sachin Jadhav sir and guide all the aspirant students regarding GPAT preparation on the topic 100 Day Strategies for GPAT.
Mohit sir, can I take one minute?
Yes, sir. Yes, sir. So I request our principal, sir, Dr. Vijay Jagtap, sir, to say a few words. Please, sir.
Yeah, good morning to all. Actually, we were expecting Dr. Marathi sir on the Zoom, but unfortunately, he is, I think, with us through YouTube channel. Okay, so let me please once again welcome. I'm very much pleased to welcome the today's honorable speaker, Mr. Sachin Jadhav sir. Uh, I'd like to give
Thank you,
you
sir. Thank you
just
very much.
brief. Yeah, I'd like to just give you brief regarding the Yashwantrao Bhosle College of Pharmacy. It is established.
Sir, please unmute.
Recently, we had two batches passed out. Okay, and I'm very glad to say that within these two batches, we have found so many good students who has qualified the GPAT and NIPER examinations. Okay, we weren't expected within short period Yashwantrao Bhosle College of Pharmacy will have such type of results, but definitely it's dedication of our students and obviously the faculty members and the facilities provided by the college. So the result is coming good and good. And I'm very much proud that we are getting a lot of supports, okay, through the Dr. Marathi sir. I'm really thankful to the Government College of Pharmacy, Ratnagiri. Sir has provided a very good platform. He's always there to assist my student. Recently, we have established one another club, that is Aspire Club. So those are particularly interested to crack the some aptitude test and NIPER test and eager to go for higher education in the National Institute as well as in the good subject. So it's a really proud matter. Every year we have been 6 to 7 members, students has qualified GPAT, and recently our student has been got the admission at the NIPER, Ahmedabad. Okay, one is Akshata Thakur, she has got the M.Pharm Pharmacology recently, and another fellow has got the NIPER MBA at Hyderabad. So it's a really proud moment, and I think today also they will take this current batch of the final year is having much more potential, and I'm expecting that 10 to 20% result within the batch will come through the GPAT and NIPER. So I think, dear students, today we have a lot of good opportunity that Mr. Sachin Jadhav sir is with us. He's having a very large, good experience how to prepare for the GATE and GPAT exam, and definitely you will take the advantage from this. So I wish all the success for today's webinar. Thanks once again. Thanks to coordinating committee. Thanks to Moe sir. And once again, thanks to Sachin Jadhav sir. Thank you.
Thank you very much. Thank you very much, sir. And I would like to thank you from my bottom of heart to the our principal, Dr. Jagtap sir, and my beloved teacher, Dr. Rajendra Marathi sir. Thank you for giving me this wonderful opportunity to interact with your students. Thank you very much, sir.
Sir, just one announcement I will make. Those
Yes.
students who are unable to join, okay, link is shared on the in the chat box, YouTube link, okay. Just forward that link and accordingly others can join. Okay, sir, please continue with your session. Over to Sachin Jadhav.
Yes, thank you, sir. Thank you very much for this wonderful introduction, and I am glad to be a part of this webinar. Rajendra Marathi, thank you very much.
Sachin sir, your voice is, please unmute yourself.
Yeah, thank you very much for this wonderful introduction, sir, Muli sir. And I would like to thank you from my bottom of heart for giving me this wonderful opportunity. Thank you very much, Dr. Jagtap sir and Dr. Marade sir. Now I would like to start my session. Please allow me, sir, to share the screen.
Yes, sir, it is allowed. Please proceed.
And please let me know whether I am audible and whether you are able to see the content.
Yes, sir, you are audible and we can see the slides.
Okay, thank you. Okay, so today we are here to know what will be the possible 100-day strategy and tips for the GPAT 2021 preparation. So I would like to welcome all the GPAT 2021 aspirants. Welcome you all the GPAT 2021 aspirants. So before we starting our session, we should know the background. We should know the highlights. What is meant by GPAT? What are the different? What are the importance of GPAT? What are the benefits of GPAT? What is the exam pattern? What is the syllabus for GPAT? So I would like to throw some light on it. So first of all, what is GPAT? So what is GPAT? So GPAT is nothing but it is one exam that is conducted by every year, conducted by NTA, National Testing Agency. It is conducted every year. So graduate pharmacy aptitude test. It is nothing but the graduate pharmacy aptitude test. Okay. So you can call it as it is a test to evaluate how much you are graduate in the pharmacy, or you can call it as a reflection of your graduation pharmacy. So having a scorecard means it is a reflection of your graduation. So okay, so before 2010 it was conducted by Sayaji Maharaja University Baroda, and after that it is shifted to AICTE, and from last 2 years, from 2018 it sorry 2019 and 20, so it is conducted by AICTE.
Sir, please unmute.
So from last 2 years, it is conducted by National Testing Agency. Each agency, that is AICTE, NTA, then Baroda University, has little difference between the pattern of exam. Okay. So first of all, you should know what is GPAT and what is the importance of GPAT. So I will highlight some importance of GPAT. I would like to highlight some importance and benefits of GPAT. Okay, so unless and until you know what is the benefits of this exam, what are the different benefits of this exam, you cannot plan your study, you cannot set your target. Okay, so you should know about the importance and what are the different benefits of GPAT. So what is the importance? First one is for your post graduation. So if you want to do your post graduation like M.Pharm or MS or M.Tech or Pharma MBA, obviously last three courses, that is MS, M.Tech and Pharma MBA, that is offered by National Institute of Pharmaceutical Sciences and Research, that is called as NIPER. Okay, so if you want to do your post graduation, that is M.Pharm, MS, M.Tech or Pharma MBA or any other post graduation, so GPAT is must. You must be qualified in GPAT if you want to do a post graduation. Because if you are not qualified in GPAT, there is no value. Okay. Again, if you want to do PhD or government fellowships like junior research fellow, or it will also help you in case of jobs in government or private sector. Okay, so if you want to do your post graduation, if you want to do your PhD, junior research fellowship, GPAT is important. Okay, again second is what are the benefits. So you will get a lot of financial benefits if you qualified the GPAT. So the government will give you around 12.4 thousand stipend, 12.4 thousand rupees per month for 2 years if you want to do your post graduation, for example M.Pharm or MS. Okay, so this is the major benefit. You will get a 12.4 thousand rupees per month as a stipend, okay, for 2 years, and it is not a small amount, it is around 3 lakhs rupees. And suppose that you got a government college or any other government institution, so government college will have fees around 35,000 rupees, so your total expense of 2 years is 70,000. So you will be in a profit 2.5 lakhs, you will be in a profit. Your masters will be free of cost, and there will be no burden regarding fees on your parents for your masters. Okay, so try to qualify GPAT. You must qualify GPAT. Government will give you stipend of 12.4 thousand for masters. Your masters will be free of cost. Okay, again if you want to do PhD, you will get a 35,000 per month as a stipend. Okay, it is a huge amount. Then again what are the importance, what is the benefit? So you will be prepared in the industry, academics and other jobs. So
सचिन सर, हॅलो.
yes.
सर थोडा आवाज कमी येतोय तुमचा, थोडासा मायक्रोफोन जरा जवळ.
Okay, now hello,
हॅलो.
येतोय ना आवाज आता?
हा सर, थोडासा कमी येत होता.
Okay, sir. Okay, so again, you will be prepared in the industry as well as academics. See, from last 2 3 years, most of the multinational companies, they are started selecting only GPAT qualified candidate. They have started selecting only GPAT qualified candidate. So if you are not qualified in GPAT, you are not getting jobs also. So you will be prepared in the industry as well as academics, because most of the colleges have started, most of the multinational companies like Mylan Pharmaceuticals, then Glenmark, then your Dr. Reddy's, they have started selecting only GPAT qualified candidates. So if you want to get job also, you must be in qualified in GPAT. Okay, again, preparing GPAT is not only helping you for the masters or other courses. So preparation of GPAT will also help you for other kind of exams like NIPER is there, your drug inspector is the government pharmacist, government analyst, government lecturership, or a drug control officer, or any other pharma competitive exam. Okay, preparing GPAT is not only for masters. Most of the students have false belief that GPAT is only for masters. It is not only for masters. It will also help you for the NIPER preparation, drug inspector preparation, then government pharmacist preparation, government lecturership, then your drug control officer, or any other pharma competitive exams. So preparing GPAT will also help you for preparing this kind of exam. So GPAT is not only for masters. Remember this. Then now we'll see how to apply, what is the exam pattern for GPAT, what is the syllabus, what is exam pattern, etc., etc. So you know that GPAT is usually conducted everywhere. GPAT is conducted every year. So applications for GPAT usually are announced in the November, December of every year. Okay, so exam is normally or usually conducted in the January, and you will get your result in the February. Okay, so applications are usually made in the November or December month. So for this year, until they have not made announcement regarding the applications, but I think as per my knowledge, in the second week they will announce GPAT forms. Okay, so applications are usually announced in November, December. Exam is conducted in January, and you will get your result in the February. Okay, so we will see what is the pattern of this GPAT exam. So actually it is a online exam of 3 hours. Online exam of 3 hours. You will have 125 MCQ. It is computer based test. What we call it is a CBT. It is an online exam of 3 hours. 125 MCQs will be there. So each MCQ carry 4 marks. Okay, so total marks will be 500, and for your each correct answer you will be awarded with 4 marks, and for each negative answer, or for each wrong answer, you will be awarded with -1 mark. So you can see here there is a negative marking, that is 0.25%
Hello,
negative marking is there.
Sachin sir,
Yes,
your voice is low. So,
my voice is low. Now are you getting clearly
yes.
or not? Okay, so it is an online exam of 3 hours. It consists of a 125 MCQs, and you will have a 500 marks exam. Okay, so for each correct answer you will be awarded with 4 marks, and for each negative answer, for each incorrect answer, or for each wrong answer, you will be awarded with -1 mark. So you can see there is a negative marking, 0.25% negative marking. So you must feed in this mind, feed these things in your mind, because there is a negative marking. You should not attempt too much questions. Those questions which are not sure, you are not sure about the answer, you should not have to attempt those questions. Okay, so you everybody must understand the pattern, everybody must understand the negative marking, so that you can solve the question paper efficiently. Okay, so let's see the cutoff of five last few years. So there was a, in 2014 2015, there was a cutoff of 120 marks. There was a cutoff of 120 marks. In 2016-17, there was a cutoff of 113, 115 mark respectively. Okay. In 2019 and 2018 and 18 and 19, there was a cutoff of 137, 141 marks respectively. And in last year, there was a cutoff of 161. Okay. There was a cutoff of 161. So whatever cutoff marks displayed over here, whatever cutoff marks you are able to see on the screen, they are only for general category. I am not discussing the cutoff of other reserved categories. So it is a general category cutoff. So other category cutoff will have less than this. Okay, but what is the aim? What is the reason behind discussing this cutoff? Because this will give you idea about the, how much questions you have to solve in the exam. So this cutoff marks will give you idea how much questions you have to solve in the exam. Okay, so please try to feed this in your mind. So cutoff marks. Okay, so generally 161 was a cutoff in the last year. So you can easily conclude that from observing the cutoff last years, that day by day, year by year, cutoff is increasing. Okay, so day by day, year by year is cutoff is increasing. Why it is so? Because there are a lot of guidance centers, there are a lot of coaching classes, there are a lot of everything. Most of the students, they used to prepare for GPAT, and because they are getting everything ready made, obviously the standard will increase, standards are going to be increased. So that's why cutoff is increasing year by year. Okay, so you must be prepared for that. So the cutoff will give you idea about how much number of MCQs you have to attempt in the exam. So generally 40-50 questions, generally your 40-50 correct answers out of 125 will qualify you in the exam.
Just 2 minutes. I think sir is disconnected. Hello, sir. I think connection problem. Sir, please unmute. Sachin, sir, you are not audible. Please unmute. केले ना नाही होत.
Hello.
Ah, yes, sir.
Hello.
Yes, sir. Now you are audible.
Yeah, I was not able to unmute myself. So
Okay.
now I got. So I will resume again.
Okay, sir.
Just let me know whether you are able to see the content or not.
Yes, sir. It is visible.
Okay, so we was discussing about the application, how to apply and exam pattern. So I think I have completed this. The cutoff will give you idea about the how much questions you have to attempt in the exam. Okay, so usually your 40-50 questions or 40-50 correct questions will qualify you, provided that you have attempted less than 65 questions. Okay. So in the next slide, we will see how to start your preparation, how to start your preparation, what is the syllabus for GPAT exam. Okay, so syllabus for GPAT exam is nothing but your 4-year B Pharmacy syllabus is there. Okay, so 4-year syllabus of B Pharmacy is there. Syllabus is also given by NTA. You can go on the site and you can download, but it is nothing but the 4-year syllabus of B Pharm. Okay, so ideally you should start your preparation when you are in a second year or third year itself. So that is the ideal time to start your preparation. Okay, when you are in a second year or third year, you have to decide and you have to start preparing for GPAT. Okay, but that doesn't mean that if you are in a final year and what you have to, don't worry, I will give you the strategy for final year also. Okay, so your BPharm syllabus for my convenience and for convenience of student, I have divided your BPharm syllabus in 3 parts. Okay, so part first is your basic subjects, part second is your applied subject, and part 3 is your other subject. Okay, so what are the basic subject? What are the basic subject? So basic subjects are nothing but these are the subject which are present in the first year and second year itself. Okay, so subjects like anatomy, physiology, biochemistry, microbiology, physical pharmacy, pharmaceutical engineering, dispensing pharmacy, organic chemistry, all these are called as a basic subject. Okay, applied subject, what are the applied subject? Subject like pharmacology, industrial pharmacy, biopharmaceutics, medicinal chemistry, and instrumental analysis. All these are the applied subject. Okay, and what are the other subject? Other subject like herbal drug technology, or you can call it as a pharmacognosy, then jurisprudence, then biotechnology, hospital pharmacy, drugstore business management, and recently your PCI syllabus has also added quality assurance and pharmacy practices. So all these comes under the other subject. So basic subject, applied subject, and other subject, these are the 3 part of your syllabus. So how you have to start your preparation, and from which subject you have to start your preparation. Okay, so you should start your preparation from the basic subject itself. Okay, so try to those students who are present in the third year or second year, try to finish all the basic subject in the initial 3-4 months. Okay, so why there is need to read basic subject first? I would like to highlight the points why there is need to read basic subject first. Okay, so suppose that, take one example, your pharmacology. Pharmacology is the applied subject. It is based on 3 subjects. Okay, it is based on anatomy, physiology, microbiology, and biochemistry. If these are 3 subjects are the basis for pharmacology. Okay, so if you want to understand pharmacology well, then you must be clear about these 3 subjects, that is anatomy, physiology, biochemistry, and microbiology. Suppose that you are take an example, suppose that you are reading anti-ulcer drugs or anti-secretory agent from the pharmacology. Okay, and before that you must be clear about the physiology. So if you are clear about the physiology of gastric acid secretion, if you know the physiology of gastric acid secretion, if you know what are the different factors that govern the gastric acid secretion, what is the role of your histamine receptor, if you know what is the role of histamine receptor, what is the role of your proton pump, if you know what is the role of your prostaglandin, somatostatin, then what is the influence of cholinergic system, if you know these things, you can easily classify the anti-ulcer drug, you can easily understand the mechanism of action of drug. So if you know the physiology, you can easily understand the pharmacological part. So if you know the physiology, if you know the factors or if you know the targets, you can easily classify the drug. There is no need to remember the classification. There is no need to remember the classification. You can, if your physiology is clear. So what are the different classes of your anti-ulcer drug? It is nothing but there are 6 classes. Okay. First one is your chemical antacid. In that also there are 2 subtype. That is a systemic antacid, non-systemic antacid. In the systemic, sodium bicarbonate is the example. In non-systemic, aluminum hydroxide gel, magnesium trisilicate, sodium carbonate. Okay. What is the second class? Second class is nothing but your histamine 2 receptor blocking agent. Okay. Histamine 2 receptor blockers. Example is cimetidine, ranitidine, famotidine, nizatidine. All deans. Cimetidine, ranitidine, famotidine, nizatidine, etc. All these are histamine 2 receptor blockers. Then third class will be your proton pump inhibitors. Okay. So what are the example? Azoles, omeprazole, rabeprazole, esomeprazole, dextraprazole, all azoles. These are nothing but the pantoprazole, etc. These are the proton pump inhibitors. Okay. What is the fourth class? Prostaglandin analogs. For example, misoprostol, lansinoprost. All these are the prostaglandin analog. Okay. Then next class fifth. What is the class fifth? Class fifth is nothing but the somatostatin analogs. Example is octoroid. So somatostatin analog. Class 6 is nothing but the anticholinergic. Example, atropine, your phelenzapine. So my point being is, if you know the physiology, you can easily classify the drug. You can easily classify the drug. There is no need to remember the classification. Just what you have to remember, you have to remember the name of drugs, and you can easily understand the mechanism as well as classification. There is no need to remember the classification if you have physiology cleared. Okay. Again, I would like to explain again with one example. If you suppose that if you are studying antimicrobial parts or chemotherapy part. Okay. So if you are reading antimicrobial part from pharmacology, then you must be clear about the microbiology. If you are clear about the different microbes, if you have cleared everything about the how bacteria, viruses, and other microbes like fungi, rickettsia, they grows, what is their structural components, what is the difference between gram positive, gram negative. If you know these things, you can understand easily the antimicrobial part. For example, if you know what are the different steps of bacterial gene multiplication, bacterial gene replication, bacterial DNA replication, what are the different steps and enzymes those are involved in the replication, transcription, translation. So these are nothing but the targets. These are the nothing but the targets for antimicrobial agent. So once you know the targets, you can easily classify the drugs. You can easily classify antimicrobial agent. Okay. So what they does, they are nothing but the some will inhibit the protein synthesis, some will bind to 30s ribosome, some will bind to 50s ribosome, some will prevent the attachment, some will leak the cell wall. So there are around 20 classes of antimicrobial agent. You can easily classify this if you know these basic things, if you know these basic concepts. Okay. So try to read microbiology, anatomy, physiology, and biochemistry before reading the pharmacology, so that you will understand pharmacology well. In the similar manner, for example, if you want to understand your medicinal chemistry and analysis, which are the applied subject. Okay. So if you want to understand medicinal chemistry and analysis, then you must read organic chemistry first. Okay. So there is a one part heterocyclic compound in organic chemistry. So if you read thoroughly heterocyclic compound, you can easily remember the structures of drugs from medicinal chemistry. Okay. There is only simple trick. If you know, if you are clear about the heterocyclic chemistry, you can easily remember, you can easily spot, you can easily identify the structure of medicinal chemistry. Okay. So and again, if your organic chemistry is good, then your spectroscopic part of analysis is going to be good. You can easily understand the spectroscopic part if your chemistry is good. Okay. Likewise, see, your pharmaceutics is dependent on 3 subjects. That is your physical pharmacy, pharmaceutical engineering, and dispensing pharmacy. Okay. So your industrial pharmacy and biopharmaceutics both are applied subject. Okay. That depends on the your your physical pharmacy, pharmaceutical engineering, and your dispensing pharmacy. Okay, suppose that you are reading suspension and emulsion chapter from industrial pharmacy, and if you want to understand the stability problems and stability, anything related to stability of suspension emulsion, then if you have cleared your chapter, there is one chapter in physical pharmacy, that is nothing but the surface tension and interfacial phenomena. Surface tension and interfacial phenomena, if you have clear everything about this chapter, then you can easily understand the stability problems of suspension and emulsions. Okay, again there is one chapter that is known as a chemical kinetics from the physical pharmacy. If you have cleared this chapter, then you can easily understand the biopharmaceutics and pharmacokinetics. Okay, so my point being, if you want to understand applied subject well, then you have to read basic subject first. Okay, so I think you might be clear about this, so why there is need of reading basic subject first. Okay, now we will come to the subject, different subject and their weightage for the GPAT exam. Okay, so here I have prepared one chart that is subject and their respective number of MCQs expected in the GPAT. Okay, so subjects and their respective number of expected question in the GPAT. So I will I will start. Okay, so pharmacology is the major subject. Your pharmaceutics is the major one. Then third, that is chemistry section is important, and other subject. So your paper has a 5 portions. Your GPAT paper has a 5 sections. That is a sutic section, then pharmacology section, then chemistry section, and then your cognosy, and last one is other subjects. Okay, so subject and their respective number of MCQs expected in the GPAT exam. Okay, so you might expect around 20-25 questions from pharmacology. There will be 20-25 questions from pharmacology itself. Okay, you can easily find in every paper they used to ask around 20 questions from pharmacology. Okay, as far as industrial pharmacy and biopharmaceutics are concerned, you will have around 10 to 15 questions. From medicinal chemistry, you will have 5 to 7 questions. From pharmaceutical analysis, 3 to 5 questions. Here is one thing is interested. Okay, one thing is interesting here. So there are only few points those can be asked from medicinal chemistry. There are only 5 to 6 points that can be asked from medicinal chemistry. That's why they used to ask more question from organic chemistry. Okay, so you will have around 10 to 12 questions from pharmacognosy, and you will have around 5 to 10 questions from organic chemistry. Again, you will have 3 to 5 questions from biochemistry. From anatomy physiology, you will have 3 to 5 questions. Okay, from microbiology, you will have 2 to 3 questions. Again, from biotechnology, you will have 1 or 2 questions. From pharmaceutical engineering and physical pharmacy, you can find easily 2 to 4 questions in every year's paper. Okay, from DSBM and hospital pharmacy, you will have 1 or 3 questions. You can expect 3 to 5 questions from previous year papers, and there will be few questions of calculation problems. Okay, so actually this is a subject and their respective number of expected questions from in the GPAT exam. Okay, so what are the important points from pharmacology? So from pharmacology, your general pharmacology is important. Okay, in that types of receptors, their secondary messengers, those things are important. Adverse drug reactions, what are the adverse drug reactions, types of adverse drug reaction, that is also important. Try to write down these things, because these things will nobody is going to share with you. Okay, so general pharmacology, adverse drug reactions, types of receptors, these are important. Then little bit kinetic parameters, like what is the narrow therapeutic index, what is a wide therapeutic index, example of those, like that. Then rest of the things all are important. That is nothing but the CNS part of CNS, drug acting on CNS. In that you will have anti-epileptic drug, sedative hypnotics, general anesthetics, antipsychotics. Then everything is important from that. Okay, then ANS chapter, there is a drug acting on ANS, that is sympathetic parasympathetic, that is also very important. Again, drug acting on cardiovascular system, in that also you will have anti-anginal drug, anti-hypertensive, diuretics, then drug therapy of heart failure, etc., anti-arrhythmic drug particularly, those are important. Okay, then in the last section, that is nothing but the antimicrobial, that is also a very important chapter. So in that all particular antibiotics. So if you want detailed information about this, you can get from me. Just WhatsApp me. I will send you the important topics for each and every subject. Okay. So likewise, there are important topics for each subject. From industrial pharmacy, if you talk about the industrial pharmacy, your tablet, your sorry, pre-formulation, tablet, capsule, suspension, emulsion, then suppository, aerosols, and your parenteral products. These are very important. They used to ask the question from these chapters only. Okay, so you must be clear about these chapters. That is pre-formulation, tablet, capsule, suspension, emulsion, suppositories, aerosols, and your parenteral product. Or sometime they might ask the question from novel drug delivery system also. From medicinal chemistry, what is important? From medicinal chemistry, there are only few points. Those are important for GPAT point of view. For example, first one is your classification. Second one is your structure of compound. Third one is your structure activity relationship. Fourth one is your synthesis of important drugs. For example, synthesis of important members from each family. For example, in case of barbiturate, there is a phenobarbital. In case of benzodiazepine, there is a diazepam or chlordiazeperoxide. So that is important. In case of phenothiazine, there is a chlorpromazine. That is important. In case of penicillin, there is a penicillin G. In case of cephalosporin, there is a cephalaxine, like this. So synthesis. Then last point is that is given in the your syllabus, first chapter of your medicinal chemistry. That is nothing but the drug design chapter. So pro drugs, what are the pro drugs? Then the QSR parameters. So in that lipophilic, electrophilic parameters are there. Those are important. Okay, so there are only 6 points. Those are important from medicinal chemistry. In pharmaceutical analysis, actually analysis is a very big subject and a lot of things that can be asked from pharmaceutical analysis, but I don't know why they are not asking much questions from pharmaceutical analysis in the GPAT. But obviously in the NIPER they used to ask the questions. Okay, so there may be 3 to 5 questions from analysis, and from that might be from any part, like your volumetric analysis, all the type of titrations, like indicator range, what type of indicator is used in the particular titration. uh, I don't know whether a student remember or not. You might be able to recall. There was one question in GPAT 19, PM indicators. Okay, so PM indicators are used in the complex geometric titration. PM indicators means what? Metallochromatic indicators. Okay, so likewise that you will have around 1 or 2 questions from volumetric also, and they might ask question from spectroscopic part or chromatographic part. Okay, then next subject is jurisprudence. In case of jurisprudence, everything is important. All the acts and their penalties, all the acts and their penalties, all the acts and their years. Then different particularly the drug and cosmetic act is very important. So different kind of forms, different kind of application forms, different kind of license. Okay, so duties of drug inspector, DTAB, members of DTB, members of your councils, state permanent council, central council, likewise that. Okay, those things are important. In case of pharmacognosy, uh, your general pharmacognosy is important. Then your alkaloids, glycosides, these are very important. Okay, in that you have to read names, synonyms, then then your geographical source, then microscopic characters is important, then chemical constituents is important, chemical components is important. In that also there are which one is active, which one is inactive, which one is responsible for which specific activity. That is important in case of pharmacognosy. Okay, so suppose that there is one example of morphine alkaloids. So morphine alkaloids are classified into 3 groups. Okay, that is phenanthrene alkaloids, benzyl isoquinoline alkaloids, and narcotin alkaloids. Okay, so you must remember the example of these classes. In case of phenanthrene, morphine, codeine, and thivane. In case of benzyl isoquinoline, papaverine. Okay, so like papaverine is optically inactive. Likewise that. So these kind of questions they can ask from the pharmacognosy. In case of organic chemistry, your SN1, SN2 reaction is important, E1, E2 reaction is important, your stereochemistry is important, your heterocyclic compounds are important. Okay, Then there are few questions of rearrangement reactions and reactions of aldehyde ketones. Those are like on the 12th basis. Okay, so these are the important point from organic chemistry. In case of biochemistry, everything is important. Your carbohydrate, lipids, proteins, amino acids, nucleic acid, all these chapters are important. Okay, in that biochemistry you can uh, highlight one point, that is deficiency disease and disorders. That is the most important. Okay, in case of anatomy physiology, your all the systems like your blood, then your cardiovascular system, circulatory system, respiratory, digestive, then skeletal system. Okay, these are very important. You can easily you can, if you have studied previous year paper in 2019, there was a question of hemocrat. Okay, what is the what will happen if hemocrat value is more than 50 to 35 to 50%. So you must remember the what is normal value and what is the significance of less than and more than. So hemocrat value less than will result in the anemia, hemocrat value more than will result in the polycythemia. Okay, so likewise this, there was also question from skeletal system. So a fibrous joint present in the skull, that is nothing but the sutures. So last year there was a question in GPAT-20. So all the system are important. Okay, in case of microbiology, you can read only particular points like your gram staining, difference between gram positive, gram negative bacteria. Okay, gram staining, different type of staining technique. Then microscope, different type of microscope, that is also important. And immunity chapter is very important from microbiology. And there is one more point from microbiology, that is known as source of antibiotics and their microbial source of antibiotic. That is important. Again, growth cycle of bacteria, that is also important. Then component of culture media, that is important from microbiology. From biotechnology, only plant tissue culture is important and recombinant DNA technology is important. Only those two parts are important from biotech. Okay, so you will have around one or two questions from biotech, or you can read if you want to read. Then pharmaceutical engineering, everything is important. Size reduction, size separation, drying, evaporation, crystallization, then your humidification, dehumidification, everything is important. Material construction also. Even in the last year, there was a question from material construction, which one is a not important factor for pharmaceutical industry. And there was options. The correct answer was soil. Okay, so my point being, they can ask anything from any subject and from any corner of any subject, they can ask anything. They have given the syllabus, they can ask anything. So you have to read everything. Okay, in case of physical pharmacy, your few chapters are important, like your uh, chemical kinetics, micromeritics, then suspendential interfacial phenomena, then rheology. Okay, these are the 5 to 6 chapters, those are important from physical pharmacy. And DSBM and is hospital pharmacy, you have to read. They can ask anything. You can expect few questions from previous year paper also, and calculation part. Okay, so in the next slide we will see. So what are the special tips for exam? We'll see what are the special tips for exam. Okay, so special tips in the at the end, I will discuss the 100 days strategy. Don't worry about that. Okay, so what are the special tips for exam? So first one is, you have to read question carefully. You have to read the question carefully and understand the question first, and then answer it. Otherwise, what happens? Most of the students used to read the question, they used to answer in the excitement, and their answer gets wrong. Why? Because they have not read the question carefully, and they have not understood the question carefully. Okay, so first read the question carefully, understand first, and try to identify the words like not, except, or, absent, all from the question, because these kind of word will change your answer totally. Okay, so try to read the question carefully and try to find out these kind of word, if any. Okay, because this type of word will change your answer totally. Okay, then answer. Okay, so if you read question carefully and understand, your 50% work is done, so you can easily answer the question. Then you have to decide what is your expectation from the exam. Okay, you have to decide your aim, whether you just want to qualify the exam, or whether you want to qualify with good rank, or whether you want to get a very good rank, that is top 25. So you have to decide your aim, you have to set your target, and then you have to work accordingly. Okay, so depending upon your study, depending upon your sitting capacity, depending upon your reading capacity, you have to decide the aim, what you are expecting from the exam. Okay, so you are, if you want to just qualify, then just try to solve 50 or 60 questions, easy questions. Okay, out of 125 there will be 50 questions or 50 60 questions, those are very easy, those who you can solve with 100% accuracy. So those who student who just want to qualify, just target 50 to 60 questions, you can easily qualify. Okay, or those student who just who want to qualify with good rank, okay, then they must go around 80 questions, they must solve around 80-85 questions, and try to maintain the 100% or at least 90% accuracy of answers, so you will get a good rank, maybe around 300 400. Okay, so if you try to solve 80 questions, and out of that 60 or 70 questions are correct, you will get a good rank. Okay, and those students who want to get a rank below 25, then they must go around 9500 questions, 90 9500 questions. Okay, so with 90% accuracy, they will get a top 25, within the top 25. So first of all, decide yourself what you are expecting. So you be then do accordingly. So if you want to just qualify, just attempt 50 to 60 questions. If you want to qualify with good rank, then attempt 80 questions. And if you want to get top 25 rank, then you have to attend 90-95 questions. Okay, and again here I would like to highlight one point: do not try to solve the problems, do not try to solve the problems which involves the complicated calculations. Do not try to solve the problems which involves complicated calculations, because see, NTA is not going to provide you any type of calculator, NTA is not going to provide you any type of log table, and though they provide log table, and I know 85% of the student don't know how to use log table, so it is not easy to make a calculations. So do not try to solve complicated problems, those involves the calculation, much calculation. Okay, so you can solve easy questions like if they have asked you to calculate the child dose, if they have asked to calculate the problems which on based on allocation methods, or problems of isotonicity, you can easily calculate those kind of problems or those kind of calculation. You can solve those kind of questions, but you should not try to solve the question those involves the calculation of energy of radiation, because energy of radiation, then if they have asked you calculation of clearance, if they have asked you calculation of volume of distribution, because these type of question involves complicated calculations, and you are not if you don't have practice, it is not easy. Okay, so don't try to solve these type of questions. If you don't have practice, and if you have practiced it, then you can solve, no problem. Okay, in the next slide we will see how to study MCQs, because most of the student they used to ask me, sir, whether we can qualify just by reading the MCQs. I used to say yes, but that depends on how you study the MCQs. Okay, so for example, I will explain how to study MCQs. So here is one question in front of you, that is, which anti-inflammatory drug is a selective COX-2 inhibitor? Okay, so your options are acetaminophen, nimesulide, diclofenac, celecoxib, and naprometon. So obviously, I know most of the student will know the answer of this. It is a celecoxib, but you should not stop here. You should not stop here. Your work is not done. Okay, so your work is actually start now. So what is your work? So you have to read each and everything, you have to recall each and everything about all options. Okay, so I will explain how. So your first option is acetaminophen. So you must try to recall, acetaminophen is also known as paracetamol. Okay, so it is a analgesic and antipyretic drug. It is analgesic and antipyretic. It is not a anti-inflammatory. Remember, acetaminophen or paracetamol is not a anti-inflammatory. It is analgesic and antipyretic. It has a very low anti-inflammatory properties. Okay. So then, what is the class of paracetamol? It is a para-aminophenol derivative. Okay, it is a para-aminophenol derivative. Then what is the product of paracetamol? You must remember phenacetin. Phenacetin is the product. Phenacetin, when converted into body into active metabolite, that is a paracetamol. So paracetamol is a product. Okay, so it is a converted after metabolism. Okay, then you must remember what is the mechanism of paracetamol. So paracetamol will inhibit the COX-3 selectively. So paracetamol is a selective COX-3 inhibitor in the brain. So and also this inhibition of COX-3 is responsible for the antipyretic effect. Remember this. Then again, what is the adverse effect of paracetamol? It is a hepatotoxic. And why it is hepatotoxic? Because after metabolism, it is converted into one reactive metabolite that is known as a para-hydroxybenzoquinone imine. Okay, para-hydroxybenzoquinone imine, that is the active metabolite. Sorry, that is a reactive metabolite of paracetamol. That what does that metabolite? What it does? It causes necrosis of hepatocyte. It causes necrosis, damage to the liver cell. So that's why there is a hepatotoxicity. That is the adverse effect of paracetamol. Why? Because there is a generation of reactive metabolite that is known as a para-hydroxybenzoquinone imine. This question was asked in the GPAT as well as NIPER. Again, the mechanism was also asked in the GPAT. Okay, so you have to read in this manner. You have to read each and everything about the all options. For example, your second option, nimesulide. So what is it? It is an analgesic, antibiotic, and anti-inflammatory drug. It is a very good anti-inflammatory drug. Okay, so it is a naphthalenic acid derivative again. Okay, so it is a preferential COX-2 inhibitor. What is mechanism? It is a preferential COX-2 inhibitor. Then what is the adverse effect? So it is having also hepatotoxicity, and most of the countries have already banned this drug. Already most of the countries they are not using this nimesulide. They have banned because of various kind of adverse effect. So mostly the hepatotoxicity. Okay, then again diclofenac, you have to read each and everything about diclofenac. So diclofenac is also analgesic, anti-inflammatory, and antipyretic drug. What is the mechanism? It is also preferential COX-2 inhibitor, or you can call it as a non-selective COX-2 inhibitor. Okay, again it is a aryl acetic acid derivative. Okay, remember it is aryl acetic acid derivative. Then what is the adverse effect of diclofenac? It will cause gastric irritation. It will cause gastric irritation, and it will increase the acidity. It will cause hyperacidity. Okay, so that's why this diclofenac is always given in combination with your patient. If he prescribe you this diclofenac, he will prescribe this diclofenac with either proton pump inhibitor or either your ACE2 receptor blockers. So try to recall each and everything about the all options. In the similar manner, you must try to recall all information about the coxib. So what are the coxibs? Celecoxib, repocoxib, itrocoxib, paracoxib. All the coxibs are selective COX-2 inhibitors. See, they are the selective COX-2 inhibitor. They are very beautiful and promising anti-inflammatory agents. They are equipotent as a narcotic analgesic, but most of them are banned. Most of them are not used. Why? Because they have very serious effect on the cardiovascular system. They have serious adverse effect on the cardiovascular system. Okay, so most of them are banned because they increases your QT interval of your ECG. They causes arrhythmia. So that's why most of the agent from coxib, that is selective COX inhibitor, they are banned. They are not used. Okay, the last option is nabomethone. So it is again analgesic, antipyretic, and anti-inflammatory drug. It belongs to naphthalenic acid derivative. Then again, it is a prodrug. It is converted into active metabolite after the metabolism in vivo. Okay, so it is a prodrug. So you must read each and everything about the all option. If you read in this manner, you can easily get GPAT by reading just MCQs also. No need to go thoroughly. Okay, so you have to decide whether you want to go thoroughly using the way one. The way one is nothing but you have to read subject wise each and everything, and second way is nothing but you have to read MCQs. Okay, so I'm not going to take all MCQs. I will take another one more MCQ, and then we will start the strategy. Okay, so here is one structure. Here is one question in front of you. Identify the structure of beta blocker in given image. So your options are propranolol, bisoprolol, pindolol, atenolol. Okay, so in such a situation, what you have to do? You have to do one thing. Okay, just focus on heterocyclic ring. Just focus on heterocyclic ring. So you can see in this structure there is a which ring is this? This is an indole ring. Okay, you can see this is an indole ring, and just try to correlate with the options. So pindolol, pindolol means what? Indol, indol. Okay, so you will get a indol in the name of pindolol. So heterocyclic ring is indol, so you can correlate this kind of uh, you can correlate heterocyclic ring with the options. Okay, so it is a structure of pindolol. Okay, so in the similar manner, what is a propranolol? How its structure? So it consists of a naphthalene ring in the structure. Okay, so it consists of a naphthalene ring in the structure. Okay, and what is the difference between this atenolol and atenolol and propranolol? So you must remember, in case of propranolol there is a naphthalene ring. Okay, there is a bicyclic ring. In case of atenolol, there is no bicyclic ring. There is only one ring. Okay, likewise you have to study. Okay, again I will not going to discuss all the things. I think this question also I have already discussed. Okay, so in the next slide we will see what should be the strategy for final year student. Okay, so what should be the strategy for final year student? Okay, so those students which are in a final year and they have only 2 months in their hand for preparing the GPAT, or those who have started their preparation, it's okay. Those who have not started their preparation, they can easily qualify. Just you have to study seriously for the 2 months. Okay, so your GPAT paper has a 5 sections. Remember, your GPAT paper has a 5 sections. Your pharmaceutics is there, your pharmacology is there, your chemistry is there, your cognosy is there, your other subject. So these are the 5 sections of paper. So in the pharmaceutics you will have questions of pharmaceutical engineering, physical pharmacy, industrial pharmacy, biopharmaceutics. Okay, in pharmacology you will have a question of anatomy, physiology, biochemistry, microbiology, and pharmacology. In chemistry you will have a question of organic chemistry, medicinal chemistry, and analysis. In cognosy you will have a question of pharmacognosy. Other subject like jurisprudence, biotech, hospital pharmacy, quality assurance, pharmacy practices, DSBM, etc. Okay, so out of these 5 sections, these first 2 sections are very important. This is pharmaceutics and pharmacology. These 2 sections are very important. You have to read these sections, otherwise you will not get GPAT. So you have to read these sections, pharmaceutics and pharmacology. You should be clear about these two. So these two are compulsory. Now you have a choice in the last 3 sections, that is 4 3 4 5. You have a choice over here. If you can skip anyone. If you want to skip chemistry, you can skip. If you want to skip cognosy, you can skip. If you want to skip other subject, you can skip. But at least you have to do 5 sections. Okay, so out of these 3, cognosy, chemistry, and other subject, you can skip anyone. Or if you want to prepare all, it is well and good. If you want to prepare all the sections, that is very good. But if anybody is not able to understand chemistry part or cognosy part or this other, he or she can skip any one section out of these 3. So first 2 sections are compulsory. You have to clear about these all statistics and pharmacology, because most of the questions are going to come through these sections. You will have around 55-60 questions from these 2 subjects only. Okay, so you must be clear, these are the major sections. Okay, so out of these 5, first and second are compulsory, and you have choice in the last 3, 4, 5. Either you can prepare all 3, or either you can prepare any 2. Okay. So again, in the last 2 months, what do you have to do? In the last 2 months, you have to read charts, tables, summary, definitions, and whatever the outline is given in the standard reference book. So charts, summary, tables, definitions from standard reference book. So if you don't have time to read from reference book, so you can prepare GPAT books like fundamentals of GPAT. So but if you are able to read the charts, tables, summary, definitions, or outline, whatever given in the reference book at the end of chapter, you have to read, or whatever is given in the bold in the books, you have to read. If there is any value, for example, if you are reading UV spectroscopy, so you should remember the values 200 to 400 nanometer UV range. Then visible range is nothing but the 400 to 800 nanometer. So you should you should able to remember these kind of values. Again, IR ranges, what is the range of for aldehyde, what is the range for ketone, what is the range for amine. So 3T00 inverse centimeter inverse for amine, for ketone 1720 centimeter inverse, like that. You have to remember the values, you have to remember the applications. So whatever is given in the bold in the reference books, you have to read that, because you cannot read thoroughly. I know you have only 100 days, so you cannot read each and everything thoroughly. So try to read essence, try to read extract, try to read summary of reference books, so you will get this kind of information in the our books. Again, so last 100 days strategy for fourth year student. So what you have to do in the last 100 days. So you have to do one thing. See, your paper has a 5 sections. So it is pharmacology, cognosy, chemistry, and other subject. Okay. So these 5 sections you have to divide in the 100 days. Okay. So major section pharmaceutics you have to complete within 25 to 30 days. Okay. So you have to spend 25 to 30 days on pharmaceutics. You have to spend 25 to 30 days on pharmacology. You have to spend 10 to 12 days on pharmacognosy. You have to spend 10 to 15 days on chemistry, 10 to 12 days on other subject. So it is nothing but the distribution of 100 days. Okay. So what you have to do, you have to do only one thing. Just do only one thing. Just try to wake up in the morning. Try to wake up in the early morning. Try to wake up around 4:30. And once you wake up at 4:30 a.m., try to wash your mouth with cold water and start reading. Start reading whatever I have told you in the previous slide. Start reading from pharmaceutics. Okay. So you have to give 30 days for pharmaceutics. Read in the morning. If you have good capacity of sitting and reading, then you can read in afternoon also, but morning is must. You must read in the morning, so that you will get good concentration and you are reading, and you will get a good concentrated concentration reading. Okay. Again, in the evening or in the afternoon time, you have to solve the MCQs. Okay. So you can solve MCQs, test series, online test, MCQ practices. Okay. You have to do same thing for pharmacology. You have to do same thing for pharmacognosy, chemistry, and other subject. So you have to finish Sutics part in 30 days. You have to finish pharmacology in 30 days. You have to finish pharmacognosy in 10 days, chemistry part in 10 days, and other subject in 10 days. Okay. So your 100 day will be utilized. In the morning you have to study the theoretical part. In the afternoon you have to practice the MCQs, or in the evening you have to practice the MCQs. Okay. So if you don't have time to read from reference, if you don't have time to read from reference book, and you want summary, you want essence, you want extract, you want essence of reference book, and you want to read only important points from reference book. So everything is collected in this book. That is fundamentals of GPAT. If you read this book, you can easily qualify. Okay, but there is one condition: you have to read at least 2 times. You have to read at least this book 2 times. Okay, so you can read these books and you can easily qualify. So if anybody has doubt regarding books, anybody wants to inquire, they can WhatsApp me on this number. There is a number, WhatsApp number displaying on your screen. Okay, so this was the strategy for 100 days strategy for GPAT. So hope you have understood it, and thank you for your presence. And if I will, hello, sir, Muli sir.
Yes, sir.
So we will have a short session of question answer. If anybody has having any questions, they can ask.
Yes, yes,
Right?
yes, yes,
Okay.
yes.
So
So, students, if any questions you have, please ask, unmute yourself, and then you can ask the questions.
or they can comment.
Or they can also type in chat box also. So accordingly, sir will answer. Yes, if any questions, please type in chat box, or you can just unmute and you can also ask.
If anybody is having any questions, they can ask. Any doubts, everything will be cleared. Try to be, I will try to clear everything. Whatever your questions are there, I will try to clear it.
Okay, sir. I think one question is there.
Yes.
Sir, one student is asking regarding about books, whether that books are available online, whatever you show.
Yeah, that books are available with me. You can WhatsApp me on my number. My number is 9766654377. You can WhatsApp me. I will give you the procedure how to buy that books.
Okay, okay. Sir, is it available online like
Yeah,
Amazon?
it is available online, but
Okay, okay.
don't order from Amazon Flipkart. Try to order from me because Amazon Flipkart they are doing some silly mistakes, printing mistakes. Because in Amazon Flipkart, I have not listed the book. The publisher has listed the book.
Okay.
So from their side, there are some few mistakes. So if you want to get updated copies, you can order from me.
Okay, sir.
Anything else related to GPAT? Any questions related to preparation? Any questions about preparation? If any, they can ask.
Sir, one question is there from Shraddha. Okay.
Yes.
How to study the GPAT with regular study?
Yeah, you
Regular.
can see if you study regularly, whatever you are studying for semester exams or whatever you are attending the lectures. So suppose that you are attending a lecture or suppose that you are attending a practical. So try to attend the lecture seriously. Try to get things clear. Try to get your basics clear. And if suppose that you are synthesizing any drug, then try to write that reaction. Those reaction as it is they used to ask in the GPAT exam. So GPAT exam is nothing new. So whatever you are doing in the regular studies, whatever your lectures are attending, whatever your practicals are conducted, that is nothing but the your GPAT. That is nothing but they are going to ask same thing in the GPAT, but in just specific manner, just in a depth. That's all. So if you do your lectures, your practical seriously, you can easily qualify. There is no need to do extra efforts. There is no need to do anything other than this, but provided that you should be a very concentrate, you should concentrate your lectures, you should concentrate your practical. Whatever you are doing in the practical, just try to do seriously. For example, if there is a you are doing practical of different kind of stomata. If you are doing practical of stomata, you are using camera lucida and you are observing different type of stomata. So at that time in practical, in theory part of practical, you are writing different type of stomata and their example. So do that clearly, do that seriously and at a one time. So try to do the things at the same time. There is no need to read again. Okay, so you have to write different type of stomata. What is parasitic, what is anisocytic, what is anomocytic, so what is ranunculosis. So try to remember the names, synonyms and examples of drug containing that type of stomata. That's it. Because they are going to ask the questions, same questions. Okay, so what is parasitic stomata, what are the example of, I think last year there was one question uh, on coca. So coca plant consists of which kind of stomata? So it is a parasitic. So if you have done that practical seriously, you can easily remember the things. There is no need to do extra efforts. But the major problem with student is that they are not serious about their study. They are not attending lectures seriously, they are not listening their lecturers seriously, they are not doing practical seriously. That's why they have to study extra for the GPAT. Otherwise it is not needed.
Sir, one more question. For us, for synthesis in medicinal chemistry, can we concentrate only the drugs which are given in syllabus? Okay.
Yes,
Uh,
sure.
or
Obviously
because
whatever.
as university, different universities have a different syllabus. So we can concentrate only on that drug, or we have to read everything in book,
No, no,
all
no
drugs.
need, no need to read everything. Just try to focus on whatever is given in the syllabus, or try to focus on synthesis of those particular drugs which are the first member of family. For example, in case of barbiturate, phenobarbital is there. In case of tricyclic antidepressants, there is a phenothiazine. In case of benzodiazepines, there is a chlorodiazepoxide or diazepam. So you have to at least focus on the first member of family. Okay, or you can read whatever given in the syllabus. No need to read everything.
So one more question. How to study and remember the medicinal chemistry structure classification for GPAT?
Yeah, as I have told you, you can easily remember the structure. If your heterocyclic compound is very clear, heterocyclic chemistry is clear, you can easily remember the structures. Okay, so try to find out, try to correlate the things, try to correlate the name, and try to find out the heterocyclic ring in the structure. If there is a amino, for example, if they are given a paracetamol structure, so it is an amino phenol. So there must be amino group and phenol. Okay, so you have to correlate like this. As I have demonstrated one example of pindolol. So there is an indole heterocyclic ring in the structure. So you have to correlate the things. Okay. In case of propranolol, you will have a naphthalene ring like that.
Okay. Anything else? Anyone want to ask any question?
And for classification, you have to remember that you have to mug up the classification as per as medicinal chemistry classes are concerned. So you have to mug up that. But once you if you mug up the classification, then you can easily identify the structure also. Because if you mug up the classes, if you know the classes, and you can easily you know the examples also, so you can easily correlate those things with the structure.
Uh, okay. So anyone else want to answer the questions? Okay. I think no questions. So now I request everyone to please start the camera so that we can take one snap. I request all the students, please start your camera. Everyone, please start camera.
My audio was clear or not?
Yes, sir,
Because
it's
I
clear.
have doubt. Yeah.
Clear, clear.
Was clear throughout the session?
Yes, yes, yes. In
Okay.
between, initially it was low, but later it's clear.
Okay. Thank you.
Okay, so at the end, I would like to thanks today's resource person, Mr. Sachin Jadhav sir, for very nice presentation. Definitely, whatever the tricks sir had given, it will be useful for all the GPAT aspirant students. If in between any queries are there in your mind, you can contact with sir. Sir had already shared the WhatsApp number also. Okay, and sir had written a few books regarding that NIPER GPAT also. If you want to order, accordingly you can WhatsApp the sir. Accordingly he will answer and help in all respects. Okay, so once again at the end, I would like to thanks Mr. Sachin Jadhav sir for having a very nice presentation. Uh, I would like to also thanks Principal Government College of Pharmacy, Dr. Rajendra Marathe sir. I would like to also thanks our Principal Dr. Vijay Jagtap sir for helping me to arrange this webinar. And once again, I would like to thanks all the participants and all the students also for attending this today's webinar. So once again, thanks to everyone. Thank you. Thank you.
Thank you very much, sir. Thank you very much, sir. And I would like to thank from my bottom of heart to giving me opportunity, because this is a wonderful opportunity to interact with the student. And I would like to thank you, Dr. Marathe sir and Dr. Principal sir, our principal sir. Thank you very much for this session.
Thank you. Thank you, sir. Thank you.
Should I end the call?
Yes, sir. Yes.